Hello, welcome to RAAONLINE. I am Vijay Raghavan. The topic today is investigations for thyroid disease. We'll start with the first most commonly done investigation, laboratory tests. It includes TSH, T3 which can be free or total, T4 which can be free or total. The second important group is anti-thyroid antibodies, which includes long-acting thyroid stimulator, anti-thyroperoxidase antibodies, anti-thyroglobulin antibodies, anti-TSH receptor antibodies, and to a certain extent we can include serum calcitonin also. We will discuss the whole topic in detail now. Coming to TSH, this is the most important component of the thyroid function test. It directly reflects the hypo or hyperfunctioning thyroid tissue. Now, what are the pitfalls in estimating TSH? In subclinical hypothyroidism, where T3, T4 are normal, TSH may be elevated. Second is, there is a time lag before it returns to normal after correcting the abnormal thyroid status, either hyper or hypo. So, immediately after correcting the thyroid dysfunction, if you try to monitor it with a TSH, it may not be the right thing to do. In secondary hyper and hypothyroidism, it does not reflect the thyroid function. Classically, when the TSH is elevated with the T3, T4 elevation, it is obviously not a primary thyroid disease. It is secondary to a TSH secreting tumor in the pituitary gland. Most important thing to remember is it may be normally elevated in elderly people. So, TSH interpretation in an elderly person have to be carefully done. So, in all these conditions, the T3, T4 level is not correlated with the TSH. Now, coming to T3 and T4, as we said, there are two measurements, the free T3, free T4, total T3 and total T4. Now, thyroid hormone is bound to thyroid binding globulin, that's the most important thing. Transthyretin, again, it's not very clinically important, and albumin. So, any condition in which there is an alteration in the carrier protein, it's going to affect your total T3 and T4 estimation. Now, conditions affecting the binding protein estimation are pregnancy. In pregnancy, the thyroid binding globulin is very high. In acute illness also, it can come down. Drugs, estrogen, tamoxifen, opioids can increase the thyroid binding globulin. Androgen and steroids reduce the TBG. So, monitoring the patient for euthyroid state, we need to know free T3 and T4 estimation as it becomes mandatory. While total T3 and T4